Hello, I'm Dr. Clemens Budde and I'm a nephrologist who specializes in treating patients with TSC. Now I would like to share my experiences with you. The diagnosis of TSC is often made in childhood, typically within the first few years. Because I work at a referral type center, I often see patients who have a long history of TSC and have been diagnosed at other centers. In my experience, I would say the average age for my patients who have TSC-related renal manifestations is about 25, and I see it occur more often in women. It is somewhat widespread though, as most of my patients are around 20 years of age. But I do have some patients who are above the age of 50, and I even have a patient who is over 70 years of age. Renal manifestations associated with TSC may have varying degrees of impact on a patient's life. In many cases, a patient will not be affected at all on a day-to-day basis. Depending on the size of the tumor, the patient may not feel any pain. With a larger tumor, a patient may have flank pain, then blood in urine, and may require hospitalization. With an AML, unforeseeable bleeding may occur, but in general, it depends on the size of the AML. I find, for example, that AMLs greater than 4 to 5 centimeters are at higher risk for bleeding. There are different kinds of AMLs, and some may have diverse tissue. A fat-rich AML may not be as dangerous as a more vascularized AML. It is an AML with large vascularizations and aneurysms that may result in bleeding. I have several patients who became emergency nephrectomized in the course of severe, life-threatening bleeding. One of the first signs of renal impairment might be hypertension. Otherwise, a patient may not notice that his or her kidneys are not working properly. Patients with TSC should be monitored. Regarding renal manifestations, you have to watch for progression and then think about and introduce any appropriate interventions. Pediatric patients or adults with intellectual disabilities may require special considerations when it comes to imaging. There may not be any issues with an ultrasound, but MRI or CT may require the patient to be sedated. In my experience, parents and other caregivers are generally used to this and actually ask for sedation or an anesthesiologist, as many patients have had to undergo MRIs or CTs since early childhood. Especially if the patient has epilepsy, then they may have already had many MRIs and CTs before coming to an adult nephrologist.